parietal, temporal, also temporal, right? And occipital. We've got our frontal or coronal suture, sagittal suture, squamous suture on either side, and then lambdoid suture. Let's see if I can. This is a very good. This one doesn't have a very good. Well, actually, that's like a Warmian bone right there. That's in the suture. Usually up here, this one doesn't have very good ones at all. All right. Okay. So now let's do a little more. Okay. So we got our nasal bones. This is going to be the lacrimal bone right here, and then this portion, now we move into the ethmoid, but yeah, and then from here, let's see. Oh, and I should also mention this would be sphenoid between the frontal and ethmoid, zygomatic bone, our temporal process of the zygomatic bone, and our zygomatic process of the temporal bone, creating the zygomatic arch. We have our inferior orbital fissure, superior orbital fissure. Then while I'm from this position here, we're going to go perpendicular plate that articulates with the vomer, creating the nasal septum, separating the right and left nasal passages. Then we have our inferior and superior, inferior middle nasal concha, maxilla, and those are each one of these alveolar processes. All right. And then right while we're here, so we got anterior, posterior. Here's your palatine bones on either side. Okay. And then this is the maxilla, and between the maxilla and this is kind of the roof of the maxilla and the palatine bones, we form the hard palate. We've got our pterygoid process with the medial pterygoid plate and the lateral pterygoid plate. Same here, medial plate, lateral plate. Foramen magnum. We've got our, for our occiput bone, we have our external occipital protuberance with the superior nuchal lines and then inferior nuchal lines right here. I think I already said the foramen magnum, and then on either side are occipital condyles. And the next features are part of the temporal bone, right? So we have our mastoid process, external acoustic canal or auditory meatus, whichever you want to use, styloid process, and then we have our mandibular fossa. And from the inferior view, what we can also visualize is the jugular foramen, and then here would be our carotid canal. Enters here, goes across, and then would come out where this little indentation is. It would actually come out and go up to the brain from there. Okay? But when I test for this, I use an inferior view. I'll usually, sometimes we wrap it around, so it's obvious. All right, but we also can see some other foramen from this view. So if I were looking inside the skull, this is the bottom of the sella turcica. So on either side of the sella turcica, we have the foramen lacerum. And then we move out laterally, and we have the foramen ovale and then this would be the foramen spinosum. You cannot see because the rotundum's back up underneath the inferior, the lesser wing. You don't see it because it's right here. You don't see it from, you can see it's actually heading that direction, right? So you don't see it, it's back up underneath here, okay? So now we'll look at those.
That was a rotundum.
That's the, yeah, this is the rotundum right here. So I'll just like do it from the inferior view. So on either side of the hypophyseal fossa of the sella turcica, right, we have the foramen lacerum, foramen ovale, and then posterior to that, the spinosum and rotundum right here. Okay, so if I go through this area, I will come out.
Occipital.
This is your optic canal, the optic nerve. Like the eyeball would be right here, and the optic nerve would be on the posterior aspect of that, and then connect to where it does in the brain. Okay? All right? Okay, good. I think I mentioned these already, inferior and superior orbital fissures. Then this is the frontal cranial fossa, right? And this portion here, the ethmoid bone. So this is our cribriform plate that the crista galli sits atop, and then the little indentations in some of the skulls, they actually are, they are patent, they're open, and so those are your olfactory foramen, okay, that the olfactory nerves drop down in. So then again, our sella turcica with the hypophyseal fossa and the dorsum sellae, all right, internal acoustic canal or auditory meatus, whichever one you choose to use. Here's a view of the jugular foramen from here, and the foramen magnum. Our middle cranial fossa and posterior cranial fossa. And I'm trying to think what I haven't covered, which I think I've covered everything, I believe.
Can you go through the, was it lacerum or the, what's it called, the slits in the eye?
Oh, this is the inferior orbital, so the orbit. A fissure is a slit, a crevice. So inferior orbital fissure, superior orbital fissure, and then there, so kind of split the difference. I mean, it's more next to the superior, but that's the optic canal right there. So, because if I stick that back through, right? Optic canal, yeah. Yeah, so I think that's about everything for that, yeah?